Flexibility. This is the absolute range of movement in a joint or series of joints that is attainable in a momentary effort with the help of a partner or a piece of equipment. Flexibility is not something general but is specific to a particular joint or set of joints. Being flexible in one area or joint does not necessarily imply being flexible in another. Being loose in the upper body does not mean you will have a loose lower body. Furthermore, flexibility in a joint is also specific to the action performed at the joint. There are types of flexibility. First is dynamic flexibility. It is the ability to perform dynamic movements of the muscles to bring a limb through its full range of motion in the joints. Next, static active flexibility. The ability to assume and maintain extended positions using only the tension of the agonist and synergist while the agonists are being stretched. For example, lifting the leg and keeping it high without any external support. Then, static passive flexibility. The ability to assume extended positions and then maintain them using only your weight, the support of your limbs, or some other apparatus. Note that the ability to maintain the position does not come solely from your muscles, as it does with static active flexibility. Being able to perform the splits is an example of static passive flexibility. Some of the more common factors which limit one's flexibility are bone structure, muscle mass, excess fatty tissue, and connective tissue. When connective tissue is overused, the tissue becomes fatigued and may tear, which also limits flexibility. When the connective tissue is unused or underused, it provides significant resistance and limits flexibility. The elastin becomes too fray and loses some of its elasticity, and the collagen increases in stiffness and in density. With appropriate training, flexibility can and should be developed at all ages. This does not imply, however, that flexibility can be developed at the same rate by everyone. In general, the older you are, the longer it will take to develop the desired level of flexibility. Hopefully, you'll be more patient if you're older. The main reason we become less flexible as we get older is a result of certain changes that take place in our connective tissues. As we age, our bodies gradually dehydrate to some extent. It is believed that stretching stimulates the production or retention of lubricants between the connective tissue fibers, thus preventing the formation of adhesions. Hence, exercise can delay some of the loss of flexibility that occurs due to the aging process. Strength training and flexibility training should go hand in hand. It is a common misconception that there must always be a trade-off between flexibility and strength. Obviously, if you neglect flexibility training altogether in order to train for strength, then you are certainly sacrificing flexibility. However, performing exercises for both strength and flexibility need not sacrifice either one. As a matter of fact, flexibility training and strength training can enhance one another. There are certain types of stretching. First is static stretching. Many people use the terms passive stretching and static stretching interchangeably. However, there are a few people who make a distinction between the two. Static stretching consists of stretching a muscle to its farthest point and then maintaining or holding that position. Whereas passive stretching consists of a relaxed person who is relaxed while some external force, brings the joint through its range of motion. Next, dynamic stretching. This involves moving parts of your body and gradually increasing reach, speed of movement, or both. Do not confuse dynamic stretching with ballistic stretching. Dynamic stretching consists of controlled leg and arm swings that take you gently to the limits of your range of motion. Ballistic stretches involve trying to force a part of the body beyond its range of motion. In dynamic stretches, there are no bounces or jerky movements. An example of dynamic stretching will be slow, controlled leg swings, arm swings, or torso twist. Dynamic stretching improves dynamic flexibility and is quite useful as part of your warm-up for an active or aerobic workout. PNF stretching is an acronym for proprioceptive neuromuscular facilitation. It is not really a type of stretching, but is a technique of combining passive stretching and isometric stretching in order to achieve maximum static flexibility. Actually, the term PNF stretching is itself a misnomer. PNF was initially developed as a method of rehabilitating stroke victims. PNF refers to any of several post-isometric relaxation stretching techniques in which a muscle group is passively stretched, then contracts isometrically against resistance while in the stretched position, and then is passively stretched again through the resulting increased range of motion. PNF stretching usually employs the use of a partner to provide resistance against the isometric contraction, and then later to passively take the joint through its increased range of motion. It may be performed, however, without a partner, although it is usually more effective with a partner's assistance. Stretching also has its benefits. It enhances the physical fitness, the ability to learn and perform skilled movements. It increases the mental and physical relaxation, enhances development of body awareness. It reduces the risk of injury to joints, muscles, and tendons, muscle soreness, and muscular tension. It increases the suppleness due to stimulation of the production of chemicals which lubricate connective tissues. It also reduces the severity of painful menstruation in females. Some of the common mistakes made when stretching are improper warm-up, inadequate rest between workouts, overstretching, performing the wrong exercises, and performing exercises in the wrong sequence. Stretching is not warming up. It is, however, a very important part of warming up. Warming up is quite literally the process of warming up. A proper warm-up should raise your body temperature by 1 or 2 degrees Celsius and is divided into 3 phases: the general warm-up, the stretching, and the sport-specific activity. It is very important that you perform the general warm-up before you stretch. It is not a good idea to attempt to stretch before your muscles are warm. It is also important to note that active stretches and isometric stretches should not be part of your warm-up because they are often counterproductive. The goals of the warm-up are an increased awareness, improved coordination, improved elasticity, and contractibility of muscles, and a greater efficiency of the respiratory and cardiovascular systems. Many of us have our own internal body clock, or circadian rhythm, as it is more formally called. Some of us are early morning people, while others consider themselves to be late nighters. Being aware of your circadian rhythm should help you decide when it is best for you to stretch. Most people are more flexible in the afternoon than in the morning, peaking from about 2:30 p.m. to 4 p.m. Also, evidence seems to suggest that during any given day, strength and flexibility are at their peak in the late afternoon or early evening. If this is correct, then it would seem to indicate that, all else being equal, you may be better off performing your workout right after work rather than before work. Immediately following your general warm-up, you should engage in some slow, relaxed, static stretching. You should start with your back followed by your upper body and lower body, stretching your muscles in the following order: your back, sides, neck, forearms and wrist, triceps, chest, buttocks, groin, shin, thighs, calves, hamstrings, and instep. Once you have performed your static stretches, you should engage in some light dynamic stretching, leg raises, and arm swings in all directions. You should do as many sets as it takes to reach your maximum range of motion in any given direction. But do not work your muscles to the point of fatigue. Sport-specific activity. The last part of your warm-up should be devoted to performing movements that are a watered-down version of the movements that you will be performing during your athletic activity. The last phase of a warm-up should consist of the same movements that will be used during the athletic event, but at a reduced intensity. Such sport-specific activity is beneficial because it improves coordination, balance, strength, and response time, and may reduce the risk of injury. Stretching is not a legitimate means of cooling down. It is only a part of the process. After you have completed your workout, the best way to reduce muscle fatigue and soreness is to perform a light warm-down. This warm-down is similar to the second half of your warm-up. Sport-specific activity followed by stretching can reduce cramping, tightening, and soreness in your fatigued muscles and make you feel better. There are also elements of a good stretch. First is isolation. The fewer muscles you try to stretch at once, the better. For example, you are better off trying to stretch one hamstring at a time than both hamstrings at once. By isolating the muscle you are stretching, you experience resistance from fewer muscle groups, which gives you greater control over the stretch and allows you to more easily change its intensity. As it turns out, the splits is not one of the best stretching exercises. Not only does it stretch several different muscle groups all at once, it also stretches them in both legs at once. Second will be leverage. If you have good leverage, not only are you better able to achieve the desired intensity of the stretch, but you do not need to apply as much force to your outstretched limb in order to effectively increase the intensity of the stretch. This gives you greater control. Lastly is risk. Although stretch may be very effective in terms of providing the athlete with ample leverage and isolation, the potential risk of injury from performing the stretch must be taken into consideration. Even an exercise offering great leverage and great isolation may still be a poor choice to perform. Some exercises can simply cause too much stress to the joints. They may involve rotations that strain tendons or ligaments, or put pressure on the disc of the back, or contain some other twist or turn that may cause injury to seemingly unrelated parts of the body. Stretching should also have its duration, counting, and repetition. A good common ground seems to be about 20 seconds. Children and people whose bones are still growing do not need to hold a passive stretch this long. Holding the stretch for about 7 to 10 seconds should be sufficient for this younger group of people. While counting during a stretch is not, by itself, particularly important, what is important is the setting of a definite goal for each stretching exercise performed. Counting during a stretch helps many people achieve this goal. Many sources also suggest that passive stretches should be performed in sets of 2 to 5 repetitions with a 15 to 30-second rest in between each stretch. Stretching can be also done with a partner. Stretches performed with the assistance of a partner can be more effective than stretches performed without a partner. This is especially true of isometric stretches and PNF stretches. The problem with using a partner, however, is that the partner does not feel what you feel, and thus cannot respond as quickly to any discomfort that might prompt you to immediately reduce the intensity of the stretch. When stretching for the purpose of increasing overall flexibility, the stretching routine should accomplish at the very least two goals: to train your stretch receptors to become accustomed to the greater muscle length, to reduce the resistance of connective tissues to muscle elongation. If you are attempting to increase active flexibility, you will also want to strengthen the muscles responsible for holding the stretched limbs in their extended positions. If you're very serious about increasing overall flexibility, it is recommended religiously adhering to the following guidelines. Perform early morning stretch every day. Warm up properly before all athletic activities. Make sure to give yourself ample time to perform the complete warm-up. Cool down properly after all athletic activities. Always make sure your muscles are warmed up before you stretch. Perform PNF stretching every other day and static stretching on the off days. Sometimes we do stretch and we feel pain. If you are already experiencing some type of pain or discomfort before you begin stretching, then it is very important that you determine the cause of your pain. Once you have determined the cause of the pain, you are in a better position to decide whether you should attempt to stretch the affected area. Severe pain usually indicates a serious injury of some sort, and you may need to discontinue stretching and or exercising until you have sufficiently recovered. If you have stretched properly, you should not be sore the day after you have stretched. If you are, then it may be an indication that you are overstretching and that you need to go easier on your muscles by reducing the intensity of the stretches you perform. Overstretching will simply increase the time it takes for you to gain greater flexibility. This is because it takes time for the damaged muscles to repair themselves and to offer you the same flexibility as before they were injured. One of the easiest ways to overstretch is to stretch cold. A maximal cold stretch is not necessarily a desirable thing, but just because a muscle can be moved to its limit without warming up doesn't mean it is ready for the strain that a workout will place on it. Splits. Doing a full split looks impressive, and a lot of people seem to use it as a benchmark of flexibility. But it will not, in and of itself, enable you to kick high. Kicking high requires dynamic flexibility, and to some extent, active flexibility. Whereas the splits requires passive flexibility. You need to discern what type of flexibility will help you to achieve your goal, and then perform the types of stretching exercises that will help you achieve that specific type of flexibility.